What does LSIL mean on a pap smear result? Imagine going for your routine cervical cancer screening and hearing the term LSIL. It might sound confusing, but it actually stands for low-grade squamous intraepithelial lesion. This is a medical way of describing mild changes in the cells on the surface of your cervix that are found during a pap smear test. These changes are most often caused by infection with certain types of human papillomavirus, or HPV, which is a very common sexually transmitted virus. When your doctor sees LSIL on your results, it means the abnormal cells are only mildly altered, showing what is called mild dysplasia. This is important because it indicates that the cells are not cancerous, but they are not entirely normal either. The good news is that LSIL is considered a low-grade lesion, which means the risk of it progressing to cervical cancer is quite low. Studies show that less than 1% of women with LSIL develop cervical cancer, especially if the condition is monitored properly. Most of the time, LSIL does not cause any symptoms and is only found during routine screening. Since it is linked to HPV infection, especially in younger women, the immune system often clears the virus and the abnormal cells over time. That's why follow-up is essential. Your healthcare provider might recommend a colposcopy, which is a closer examination of your cervix, and possibly taking a small tissue sample called a biopsy to see how extensive the abnormality is. Management of LSIL depends on several factors, including your age, HPV status, and previous screening results. Many cases of LSIL resolve on their own without treatment because the immune system clears the infection. However, if abnormalities persist or worsen, your doctor might suggest repeat pap tests, HPV testing, or other procedures to keep an eye on the situation. The key point here is that regular pap smears are vital for early detection. Finding LSIL early allows healthcare providers to monitor or treat it before it can develop into more serious problems. It's a sign that your screening process is working to catch potential issues early, which is why routine cervical cancer screening is so important for women's health. In the broader context of reproductive health, LSIL is an early warning sign linked to HPV, the main risk factor for cervical cancer. With proper follow-up, most women can prevent the progression to invasive cancer. Remember, every person's situation is unique, so always discuss your results and next steps with your healthcare provider. They can provide personalized advice based on your health history. So, if you get an LSIL result, stay calm, follow your doctor's recommendations, and keep up with your screenings. Early detection and proper care make a big difference in maintaining your reproductive health.